Really? 7 to 10 years to get diagnosed? What does endometriosis always take time to get diagnosed? This is mandatory to understand that endometriosis, because it starts in the beginning of life sometimes, with superficial disease or even cellular disease that grow in time because of progression, with chronic inflammatory, even diet, or even sometimes the stress cause progression of the disease. So it's mandatory for us to understand that in the beginning of life, even from the beginning of menses, you may have the disease, but no one can diagnose this without imaging studies. Remember, by definition, that endometriosis grows outside the uterus. And by shame, not many OBGYNs are trained to diagnose the disease with a normal ultrasound. It cannot be seen in normal imaging studies if it's not a true endomapping. So remember, if you have superficial disease, you may have or experience symptoms like pain during menses, sexual intercourse with pain, and even endobelly, that means abdominal distension. So if you have this type of symptomatology, you must always try to go to experts that will get you diagnosed. Or sometimes when you're really young, it's really important to just change the way of life to avoid progression. So if you have endometriosis, please go to a certified center so you can avoid multiple surgeries as well as misdiagnosis.